It's really wonderful to see all of you here today. And I know that all of you have a sense of mission within you yourself. And you are also incredibly strong and dedicated leaders in adolescent health and mental illness. And I know that teens all around the nation will have benefited from your work and will continue to benefit from your work. And I see Dr. Turner is here. It's very exciting because he's one of the experts here, and I know that my constituents in Sacramento has talked about you, and I know the rest of you too also have done wonderful work. TeenScreen is so important, so very important, and it's made a great deal of progress and continues to do so, and has a genuine impact on the health and well-being of our youth. They are, after all, the future of our country. And if there's nothing more important, I think, to many of us, is to see them develop and grow the way we think that they should develop and grow. But as we know, at times that doesn't happen quite the way we all thought things were going to be when we were young. And we all know today that prevention and the early identification of illness are key components in keeping our families and communities healthy. And most people recognize the benefits of prevention when it comes to physical health. We made conscious choices along the way to improve our health by, for instance, quitting smoking, try to maintain healthy eating habits, and getting our cancer screenings. Those are things that we have consciously decided to do, and also society has also decided in its own way that those are important to do too. But somehow when it comes to mental health, it seems that we are fighting a constant battle just for the benefits of prevention and universal screenings to be recognized and implemented. So sad. We wait for something to happen first before we jump in. And by that time, it might be too late. The problem is clear. While more than 10% of our nation's youth are estimated to suffer from mental illness, nearly 80% are not identified and, in turn, do not receive any treatment. And while the face of mental illness is often that of older adults, we know the first onset of mental disorders usually occur in childhood or adolescence. And without identification, these young people miss valuable time to receive treatment, where their ailment becomes even more severe. Many, and I know this here, of our families have been affected by the consequences of a mental illness that has gone undiagnosed, and not through any fault of anybody. They're really the markers we couldn't identify them at the time. But while we think of what could have been in some of those cases, programs like TeenScreen provide an important ray of hope for the future. Not only does screening identify those at risk, but it also starts a dialogue between youth and their families to break down the stigma, to be less afraid, to be able to talk about some of the fears and challenges. As any parent can tell you, this type of open communication can be extremely difficult. Extremely. You wonder how much you should say. Sometimes you step into it and you think, oh, just let it go. It's no big deal. And there are also just the trauma of adolescence itself. How can you identify what some kind of normal adolescence versus something that may cause trouble? But we know that those who have been untreated can often get involved in drug and alcohol abuse, trouble in school, risk-taking, or even the saddest, suicide. As a member of Congress, I see the cumulative effects of these young people slipping through the cracks and the difficulties it places on the limited resources in our own communities, including the criminal justice system and our social safety net. In fact, in my own home district of Sacramento, we witnessed large jumps in mental illness issues presenting in the emergency room because our mental health safety net has been hard hit by the state and local budget cuts. And as a result, more and more individuals are going undiagnosed and untreated. This not only strains the resources of our hospitals, but it leaves individuals with a mental illness struggling to find a provider and evidence-based treatment. And if these individuals ever do find adequate services, their cases are so severe and more costly to treat, which exacerbates the strains on the individual and the system as a whole. When the costs of mental illness are looked at across the lifespan of an individual and their families, the need for prevention and early detection is clear. I remember when my sister first was diagnosed with a mental illness. She seemed to be perfectly fine. She was sandwiched in between myself and my youngest sister. Fine. A little quieter than my youngest sister and I, but getting along. And this was a long time ago where mental illness was really a stigma. So most likely nobody was looking for anything unusual. But once she went to college, it became very apparent that something was wrong. Now, during that time, there was very little that could be done, other than maybe, first of all, institutionalizing her in a private care. My parents didn't know what to do, obviously. And then going to see a psychiatrist. Very few, there were primitive drugs at that point in time. And I look back and I say, my goodness, maybe perhaps there was not enough treatment available at that time. On the other hand, I keep thinking, had we known a little bit earlier, perhaps she would have a better life today. Now, Lois can't stand here and talk about it, but I remember the early stages when she was going through the difficulties, when we were trying to figure out what was happening. All Lois wanted to do was have a normal life. She wanted to get married, have kids, raise a family. You know, the normal things you do. You know, today she still wants that. She's stuck at age 18. She still wants that. And I see glimpses of what could have been. Now today, we have made such progress, and yet we are still pushing the rock up the hill. We know that. The rock might be a little smaller, but it's still a rock, because we all know that it is still very, very difficult to have understanding. But I really find that in health issues, but in particular, mental health issues, it's really not a partisan issue at all. Whenever it hits your family, which they usually can in some way, all of a sudden, everybody comes together and says, wait a minute now, what could we do? What could we have done? And I think that that is what is going to be moving us forward in a way that probably couldn't have happened before. You know, screening is really the first step. We know that, to effectively help the young person with mental illness. Had there been some screening, we probably could have known. But today, we can have screening. And when there is screening, there are things that we can do. I have really focused my efforts on strengthening the mental health safety net, especially through a bill that I'm sponsoring, which will establish evidence-based, federally qualified behavioral health centers to strengthen our local mental health provider networks. We need these. We need this in a society that may not quite understand that this is an illness. It's like a physical illness. And once people realize this, I think our challenges will not be as difficult for people to understand why it is important to look and identify at mental illness at the earliest stages. We are doing much more with our children today to identify things in their lives that may not seem to be quite the usual. You see the diagnosis coming on with much more of attention deficit disorders, certainly with autism. So we're doing this today anyway. And I think this is only the next part of it. These initiatives of early detection and screening work hand in hand to improve the quality of life. And I think that is totally so important for all of us who have had this confusion and trauma in our lives. I look at Lois, and thank goodness, you know, she is well cared for today. But I think if you ever have something like that happening, you are really looking at, oh my goodness, it could still happen. It can happen to your children, your grandchildren, and you know it can. So let's try to prevent this. And that is really part of my mission, because I really feel that many of these things can be prevented. And people today who have suffered want to ensure that no one and no family goes through the suffering that may occur. So I look forward to seeing more happening at the national level. Things are happening at the local level, and we're bringing these up to the national level. People speaking out are so important. It's important because mental illness is just like any other illness, and we have to look at it that way. And when we do, people will understand, society will understand, that it's just another piece of what we are doing as Americans to ensure that every person could have a healthy and fruitful life. I do very much look to all of you for your leadership and your partnership and working together. Every time I get together with advocates as yourself, providers, I feel that we're going to make this. We're going to do this. We're going to ensure that no child gets left behind, in essence, that they'll have every opportunity to succeed in this life. So I thank you very much for all your work and your commitment. And I think all of you know that my office door is always open as we move forward. So thank you very much.